There is something deeply strange about the way medicine sometimes thinks. A child can die suddenly and inexplicably at 11 months of age, and medicine has a diagnostic category for it, SIDS. But after that child's first birthday, the label disappears. Hello, I am Dr. K. Paul Stoller. Now, did biology change overnight? Of course not. And that brings me to the case of Andrea Shaw. Her twins, Dallas and Tyson, were 18 months old. They received DTAP, hepatitis A, and influenza vaccines during the same pediatric visit. 8 days later, both children were dead. Their mother is now accused of murdering them by suffocation. She has pleaded not guilty. Now, I want to be extremely clear about something. The fact that these children died 8 days after vaccination does not prove that vaccines killed them, but neither does their being 18 months old prove that vaccination couldn't have played a role. Perhaps the main trigger of their demise. And that's where this story intersects with something I discovered while looking at the medical literature. There actually are studies reporting temporal associations between vaccination and sudden unexpected death. One large Italian study examined children all the way through 23 months of age. It reported approximately twice the risk of sudden unexpected death during the first 7 days after vaccination, with the strongest association following the first dose. Other studies have not found an increased risk, and that's important because I'm not asking anyone to decide the answer in advance. I'm asking why we haven't adequately answered the question. There is also an interesting German study that reported a signal following a fourth hexavalent vaccine dose during the second year of life. Second year, that's important, because by then the child is too old for the diagnostic label SIDS. But the child's biology didn't suddenly change on their first birthday. I see an analogy here with something from my own field of hyperbaric medicine. Most decompression sickness occurs relatively soon after a dive, so time becomes an important diagnostic clue. But there is a dangerous leap that can occur. Most cases happen within this window, becomes cases outside this window cannot happen. I have treated divers presenting outside conventional time expectations whom I diagnosed with decompression illness and successfully treated with hyperbaric oxygen. Nature doesn't care where we draw our administrative lines, and that's why I think we're asking the wrong question about sudden deaths following vaccination. Instead of studying only SIDS, which by definition stops at 12 months, we should study sudden unexpected deaths following vaccination from birth through at least 24 months of age, and we have databases capable of doing it. Forget trying to prove this with VAERS. VAERS doesn't have the denominators necessary to answer the question. Use a system such as the Vaccine Safety Data Link. Take millions of children. Look at deaths occurring within 1 day, 3 days, and 7 days after vaccination. Compare them with appropriate control periods. Control for age, season, and other confounders. Look separately at the first dose, later doses, and the 12 and 15 to 18-month vaccination visits. And decide all of that before looking at the results. Then count. If there's no increased mortality, fine. I'll accept that finding. The hypothesis takes a serious hit. But if there is a reproducible increase, then we need to accept that result too. And that brings me back to Andrea Shaw. I don't know what killed Dallas and Tyson. Temporal association isn't causation, but the absence of a convenient diagnostic label isn't causation either. And certainly, the absence of an accepted medical explanation does not by itself prove homicide. Mrs. Shaw is facing 2 first-degree murder charges. That makes getting this science right considerably more than an academic exercise. So, study the children from birth through 2 years. Define the windows beforehand. Use real denominators, control the confounders, and let the numbers answer the question. because there's one principle here that medicine should never forget. A diagnostic label has an age limit, but biology does not. And somewhere beyond those statistics is a mother awaiting trial for the deaths of her 2 children. That doesn't tell us what killed Dallas and Tyson. It tells us why getting the science right matters. If you like this video, let YouTube know and subscribe to follow this case.